Pain relief in labour. Many women choose to have some form of pain relief in labour. There are several options, including gas and air, pethidine, and epidurals. Epidural and spinal injections are the most effective ways to relieve pain in labour. Both are performed by a doctor specialising in pain relief, known as an anaesthetist. There is always an anaesthetist on delivery suite 24 hours a day. An epidural is a special form of injection that allows the anaesthetist to place pain-relieving medicine around the nerves in your lower back, blocking the sensation of pain. The aim of the epidural is to take away the pain of contractions, but you may still feel a sensation of pressure during contractions, which is completely normal. In order to prepare for an epidural, your midwife will monitor your baby's heartbeat throughout the procedure. A thin plastic tube called a cannula is put into a vein in your hand so that you can have fluid to keep you hydrated. Epidurals cannot offer instant pain relief. It usually takes 20 minutes for the epidural to be put in and a further 20 minutes for the pain relief medicine to work. Because of this, if you have your epidural late in labour, the anaesthetist may also give you a different form of pain relief, called a spinal, at the same time. A spinal provides faster pain relief, whilst the epidural allows regular top-ups of pain medicine throughout labour.
Bear with me for 5 to 10 minutes.
Your midwife will ask you to sit forwards or curl up on your side, and she will clean your back with a cold antiseptic spray. Bending forward or curling your back is very important, as it helps the anaesthetist to find the right place for the epidural. The anaesthetist will then inject local anaesthetic into the skin of your lower back. This will sting to begin with, but it will quickly make the skin numb. This makes putting the epidural in more comfortable for you. The safety of you and your baby is very important. Your anaesthetist will ask you to keep still while the epidural is being put in. If you feel a contraction starting, you must tell the anaesthetist so that he or she can stop and wait until the contraction finishes. The anaesthetist will place a special needle into the numb area of your back. This allows a thin plastic tube called an epidural catheter to be placed near the nerves in your spine. You will feel this as pushing or pressure. This is normal, but if you also feel pain or tingling, tell the anaesthetist. Once the thin tube is in the correct place, the needle is taken out, but the epidural catheter will stay in place until after your baby is born. This catheter allows further top-up doses of pain-relieving medications to be given at regular intervals during your labour. Just let your midwife know when you need them. Your midwife will take your blood pressure regularly after your epidural is topped up. Some women prefer to have some feeling during their delivery, so you can talk to your midwife about when to have your last top-up.
Might have a sleep now.
Yeah, no, absolutely.
Catch up with some reading, some rest.
Get some sleep.
Do some texting.
If you need an epidural, the anaesthetist will do their best to come to you as quickly as possible. However, the delivery suite can be very busy, and you may need to wait a short while until the anaesthetist is free. Who can and cannot have an epidural? Most women can have an epidural, but certain medical problems may mean it is not suitable for you. For example, women with previous back operations, spinal cord and brain problems, or problems with blood clotting may not be able to have an epidural, but safe alternatives are available. If you are overweight, it may be more difficult to put your epidural in, and it may take longer. Epidurals are very safe, and lots of women have them every year, but we must also tell you about the small chance of problems. Sometimes epidurals may not work well enough to ease your labour pain completely. If this happens to you, we can try a number of options to help. We can repeat the epidural, or combine the epidural with a spinal to provide faster pain relief. Other problems include a drop in your blood pressure, nausea and itching. You have a 1 in 100 chance of getting a severe headache after an epidural. This often goes away on its own, but some women need further treatment. The risk of damage to a nerve, which may cause a numb patch on your leg or a weak leg, is 1 in 1,000 to 1 in 13,000. Many women worry about the possibility of paralysis with an epidural, but this is actually extremely rare. Infection or a blood clot in the back is also very uncommon. Another common worry is long-term back pain following an epidural. Backache is common in pregnancy and often continues after delivery of the baby, but it is unlikely to be caused by the epidural.
To keep your pain relief at a certain level. In your legs, the more top-ups you have.
If you need to go to theatre to have your baby, strong painkillers can be injected into your epidural to ensure that you are comfortable throughout delivery. If your epidural has not worked well during labour, the anaesthetist may remove the epidural catheter and give you a spinal injection of pain medicine instead. It is safer for you to have one of these injections rather than a general anaesthetic. The anaesthetist will stay with you all the time during your operation.